Besides the filiform needle therapy and acupuncture therapy, there is also the three-edged needle therapy, cutaneous needle therapy, intradermal needle therapy, electric acupuncture, aqua acupuncture, scalp acupuncture, ear acupuncture, and acupuncture anesthesia, which are commonly used in the clinic. They have specific therapeutic effects for a number of diseases. Acupuncture techniques. Three-edged needle therapy. The three-edged needle therapy, a kind of therapy puncturing the collaterals, is to prick the patient's points or shallow vessels to deplete a small amount of blood to treat the diseases. As early as in Ling Shu, there was record of Luo collateral puncture, Zan repeated shallow puncture, and Baowan leopard spot puncture. The three-edged needle was developed from the sharp prismatical needle of the 9 needles in ancient times. The three-edged needle, 6 centimeters long, is shaped with a round handle, a triangular head, and a sharp tip. In an operation, the use of the thumb and index finger to hold the needle, and the middle finger to support the lower section of the needle, and let the needle tip come out 0.1 to 0.2 inches, so as to control the needling depth. Before the operation, massage the operating area to make the local area congested. Sterilize with 2% iodine tincture and de-iodine with 75% alcohol. Pinch or stretch the operating area with the left hand and prick swiftly with the right hand. There are 3 methods in three-edged needle therapy. 1. Prick 0.1 to 0.2 inches deep and withdraw the needle immediately. Press the punctured hole lightly to squeeze out several drops of blood. It is the spot pricking method, which is often used in the points with terminal vessels, such as point ear apex, shixuan, extra point, and so on. 2. Prick around the diseased area for 10 to 20 times continuously. It is the clumpy pricking method which can remove the stagnation of blood and water, and is often used for erysipelas in low limbs, back pain, etc. 3. Ligate the upper portion of the operating area with rubber ligature. Sterilize. Press the lower portion of the operating area with the left hand, prick the vein 0.05 to 0.1 inches deep with the right hand and withdraw the needle immediately. Let it bleed a little naturally. It is the blood-reducing method which is often used in the points where the veins can be seen with the naked eye, such as the cephalic vein at Qizhe, lung 5, the basilic vein at Quzhe, pericardium 3, and the popliteal vein at Weizhong, bladder 40. Other commonly used points in the blood-reducing method of the three-edged needle therapy are Yintang, extra point, Taiyang, extra point, Baihui, 220, ear apex, tragus, ear back, Jin, Yuye, extra point, Shixuan, extra point, filiform, extra point. 雨季, long 10. 八血, extra point. The 12 Jing points. And Ba Feng, extra point, etc. The three-edge needle therapy functions to clear away heat and relieve toxicity, eliminate swelling and relieve pain, regulate and harmonize qi and blood. It is advisable in treating various excessive syndromes, heat syndromes, blood stagnation, blockage of meridians, pain, etc. But one precaution should be taken, and that is, it is not advisable to use the three-edge needle therapy for deficiency syndromes, for females after delivery, and disturbance of blood coagulation. Cutaneous needle therapy. The cutaneous needle therapy incorporates a number of different needles for shallow punctures. The Mao shallow puncture, Yang quintuple puncture, and Ban extreme shallow puncture, mentioned in Spiritual Axis, Ling Shu, are what comprise cutaneous needle therapy. According to the shape and number of needles, the cutaneous needle is divided into the 7-star needle, plum blossom needle, arhat needle, etc. The needle is composed of the handle, head, and a group of needles. The group of needles are made of steel and fixed in the head. The 7-star needle is composed of 7 steel needles. The plum blossom needle of 5 steel needles. The arhat needle of 18 steel needles. While the rolling puncture roller is made so that the punctured surface made into a roller shape. The tapping method is the most commonly used operation in the cutaneous needle therapy. Sterilize the needle and the punctured area. Hold the needle handle with the thumb, middle, ring, and small finger of the right hand and press the handle with the index finger. Tap with the needle head, directing it at the skin. The needles touch the skin at a right angle with wrist force. It rebounds immediately when the needle pricks the skin, 80 to 120 times per minute. The stimulation is divided into light, medium, and heavy. The light stimulation is to use a light wrist force and tap the skin until it is slightly reddish. The medium stimulation is to tap the skin until it is reddish, but with no bleeding. The heavy stimulation is to use a heavy wrist force and tap the skin so that it is obviously reddish and slightly bleeding. The tapping areas are divided into tapping along the meridians, tapping the points, and tapping the local area. One. Tapping along the meridians is often used for the governor vessel and the bladder meridian on the nape, back, lumbus, and sacrum, and the meridians on the forelimbs below the elbows and knees. Two. Tapping points is often used for the specific points, the points on the affected meridians, the points on the spine, ashi points, etc. 3. Tapping the local area is to tap the diseased area directly, such as the intractable tinea, local stasis, and swelling due to sprain, etc. It is also advisable to apply the scattering puncture and surrounding puncture on the diseased area. If the area of stimulation is broad, the rolling puncture is applied. The precautions in applying the cutaneous needle therapy are sterilizing both the needle and skin thoroughly before operation. The needle tip should be even and free of hooks. The conjunction between the needle head and the handle should be firm. On tapping, the needle tips should strike the skin at a right angle to the surface to reduce pain. The tapping method should not be applied to local ulcers and injuries. The cutaneous needle therapy has broad indications. It can be applied to general diseases. It is more effective for headache, hypertension, insomnia, myopia, dysmenorrhea, intercostal neuralgia, gastrointestinal disease, alopecia, areata, and intractable tinea. Subcutaneous needle therapy. The intradermal needle therapy is also known as the embedding needle therapy. It is a therapy puncturing the custom-made needle into the skin, inserting it, and leaving it there for a period of time, to give it a slight and long-term stimulation to the skin, in order to regulate the function of the meridians and zangfu organs and to prevent and treat the diseases. There are two types of subcutaneous needle, the grain-like needle and the thumbtack type needle. Before the operation, sterilize the needle and the area to be treated thoroughly. Grip the handle of the grain-like intradermal needle with a sterilized forceps. Puncture the needle subcutaneously 0.5 to 1 centimeters, leaving its handle on the skin surface and fixing it with a piece of adhesive tape. Grip the handle of the thumbtack type subcutaneous needle with a sterilized forceps. Puncture the point perpendicularly, leaving its handle lying flat on the skin surface, and fix it with a piece of adhesive tape. This needle therapy is often used in ear acupuncture. The duration of implantation depends upon seasons. In summer, it is generally retained for a couple of days because of excessive sweating. In winter, it is retained for 3 to 7 days. During the embedding period, press the needle a couple of minutes every 3 to 4 hours so as to increase the stimulation. The subcutaneous needle therapy is often used for some chronic and intractable diseases and paroxysmal pains which need the long-time retention of the needle, such as headache, shoulder pain, trigeminal neuralgia, toothache, stomachache, irregular menstruation, dysmenorrhea, enuresis, insomnia, hypertension, asthma, cough, etc. The precautions of the embedding needle therapy are: avoid embedding the subcutaneous needle into the joints to prevent pain on motion. Avoid embedding the subcutaneous needle at the chest and abdomen because of respiration. The subcutaneous needle should be taken out immediately if the patient feels pain or motor impairment, and it is embedded again at another point. During the embedding period, keep the area around the needle clean to prevent infection. Electroacupuncture. Electric acupuncture is a therapy which sets up an electric current which is similar to the human bioelectric current on the needle when the needling sensation is obtained to function on the meridian points of the human body to prevent and treat diseases. The points and indications are almost the same as those on the filiform needle therapy. The current monitor detects by sensing general vibrations resulting from needle movements. The output is similar to the low-frequency pulse current of the human bioelectric current. The types of waveforms are the sparse wave, with a frequency of 2 to 5 times per second, having a strong stimulation, functions to relieve pain, calm the mind, promote circulation of qi and blood, induce contraction of muscles, and regulate functions of the body. It is often used for the Wei-Flaxseed syndrome, various injuries of muscles, joints, ligaments, tendons, etc. The dense wave, with a frequency of 50 to 100 times per second, functions to decrease nervous stress and is often used to relieve pain, calm the mind, relieve spasms of the muscles and blood vessels, and it is also used for acupuncture anesthesia. The sparse and dense waves, each of which lasts about 1.5 seconds, functions to promote metabolism and circulation of qi and blood, improve nutrition of tissues, and eliminate inflammation and edema. Often used for pains, sprains, periarthritis, sciatica, facial paralysis, and myasthenia. The intermittent wave, a kind of sparse wave with a regular intermittence, lasts about 1.5 seconds and functions to increase the excitation of muscular tissue and stimulate and contract striated muscle. It is often used for the wave flaccid syndrome paralysis and other ailments. During the operation, puncture the filiform needle first and manipulate the needles till the needling sensation is obtained. Switch the intensity control to 0. Link each pair of electrodes respectively to the two needles where the needling sensation has been obtained. The same pair of electrodes should be linked to the same side of the body, especially on the points of the chest and back. Switch on the power supply. Select the proper waveform. Increase the intensity of the electric current gradually and adjust the frequency according to the patient's tolerance. At this time, the rhythmic contraction of muscles can be seen in the operating area. The duration of electric stimulation usually lasts 5 to 20 minutes. Avoid using too strong an electric current in the area near the medullary bulb and spinal cord during electric stimulation. After treatment, decrease the intensity to 0 slowly. Switch off the power source. Remove the output electrodes and needles. When electric stimulation is applied to only one point, one output electrode is linked to the needle, and the other is connected to a piece of wet gauze, which, as an irrelative electrode, is fixed on the skin of the same side, slightly further away from the needle. Needles which have been used with moxa and needles with the handles made of aluminum cannot be used in electric acupuncture because of their poor electric conductivity. If they must be used, the output electrodes should be linked to the needle body. For the patient with severe heart disease, do not allow returning electric current to pass through the heart. The maximum output voltage of electric stimulation is over 40 volts. The maximum output of electric current cannot exceed 1 mA, so as to avoid electric shock. Hydroacupuncture. Hydroacupuncture, also known as injection theory, is where medication is injected at specific points to treat diseases. The commonly used prescriptions are divided into 3 types. 1. Liquid herbal extracts. 2. Vitamin injections. And 3. Other medications. Selection of points. 1. Select the points according to differentiation of syndromes in acupuncture. 2. Select the positive reaction spots by palpating on meridians and points. Three, select the most prominent tender spot in soft tissue injuries. 4. Select the points with an ear point detector. The points should be succinct, and usually 2 to 4 points are advisable. Operation. Select the hypodermic needle and syringe capacity from different sizes according to the dosage of medicine chosen to inject and the area and depth of the injection. Sterilize the skin routinely. Insert the needle swiftly, lift and thrust slowly, but never twist the needle. When the needling sensation is obtained and there is no blood drawn, inject the medication. If the dosage is high, lift the needle from the deep area slowly. Inject the medication when lifting the needle, or inject the medication from different directions. The dosage of point injection. 1. Area-dependent dosage. To be injected, for example, on the head, face, and ear, the dosage is limited usually to 0.1 to 1.5 milliliters for each point. On the extremities and back where muscles are thick, the dosage is higher, usually from 2 to 15 milliliters for each point. 2. Consider the properties and concentration of the medication. Medication with mild action, such as glucose solution and normal saline, are injected in heavy dosages. Medication with strong action, such as atropine and antibiotin, are administered in limited dosages, usually 1/10 to 1/3 of the routine dosage. And 3. Dosage for liquid herbal extracts is 1 to 2 milliliters for each point. The precautions for the operation are examining the active date of the medication and seeing if there is sediment or degeneration. Pay special attention to the incompatibility, side effects, and allergic reactions of the medication. The skin test should be done first for medication which may lead to allergic reaction. During the operation, strict aseptic techniques should be applied to avoid infections. Avoid the nerve trunk during injection. If the needle tip touches the nerve trunk, the patient would have the sensation of electric shock. You should lift the needle slightly to inject. Generally, medication should not be injected into the articular cavity, spinal cord, and blood vessels. Do not puncture too deeply at points on the chest and back, in order to avoid injury of the lung and hemothorax, and to avoid endangering the patient's life. Scalp acupuncture. Also known as head acupuncture, scalp acupuncture is to puncture specific areas on the scalp to prevent and treat diseases. Theoretically, in traditional Chinese medicine, the head is closely related to the meridians and zangfu organs. The 6 yang meridians of the hand and foot run through the head and face. So it is said that the head is the hub area of all the yang. In addition, the heart meridian of hand Shaoyin and the liver meridian of foot Jieyin also pass through the head. Therefore, acupuncture therapy emphasizes the functions of the points on the head. The stimulating areas on the head are as follows. Midline of the forehead. At the middle of the frontal area, downwards from Shenting, due 24, and is about 2 centimeters long. It mainly indicates epilepsy, mental disorders, nasal diseases, and others. Lateral line 1 of the forehead. Lateral to the middle line of forehead, proceeds downward from the Mei Chong, bladder 3, and is about 2 centimeters long. It is mainly used to treat coronary heart disease. Lateral line 2 of the forehead. Lateral to lateral line 1 of the forehead, it proceeds downwards from the Toling Qi, gallbladder 15, and is about 2 centimeters long. It is mainly used to treat acute and chronic gastritis, gastric ulcers, and others. Lateral line 3 of the forehead. Lateral to lateral line 2 of the forehead, it proceeds downward from the Towei, stomach 8, and is 2 centimeters long. It is mainly used to treat dysfunctional uterine bleeding, impotence, seminal emission, prolapse, and others. The middle line of the vertex. At the middle of the vertex, it runs from the Bai Hui, due 20, to Qianding, due 21. It is mainly used to treat low back pain, leg pain, cortical polyuria, and prolapse of the rectum. Anterior oblique line of the vertex temporal. It proceeds from the Qian Shen Cheng to the Xuanli, gallbladder 6. The upper 1/5 is mainly used to treat low limb paralysis, the middle 2/5 for upper limb paralysis, and the lower 2/5 for central facial paralysis, aphemia, salivation, and others. Posterior oblique line of the vertex temporal. Posterior to anterior oblique line of the vertex temporal, it runs from Bai Hui, due 20, to Chubin, gallbladder 7. It mainly indicates sensory disturbance. Lateral line 1 of the vertex. Lateral to middle line of vertex, it proceeds backwards from the Chengguang, bladder 6, and it is 3 centimeters long. It mainly indicates low back and leg pain, paralysis, and numbness. Lateral line 2 of vertex. Lateral to lateral line 1 of vertex, backwards from Zhengying, gallbladder 17, 3 centimeters long, mainly indicated for shoulder, arm, and hand paralysis, numbness, pain, etc. Anterior temporal line. From the Hanyan, gallbladder 4, to Xuanli, gallbladder 6, mainly indicates headache, aphemia, peripheral facial paralysis, and oral diseases. Posterior temporal line. From Shuaigu, gallbladder 8, to Chubin, gallbladder 7, it mainly indicates headache, vertigo, tetanus, and deafness. Upper middle line of the occiput. Beginning at the middle of the occiput, it proceeds through a portion of the governor vessel and ends at Naohu, due 17. It mainly indicates eye diseases, the upper lateral line of occiput, 1 centimeter lateral to the upper middle line of occiput, and is as long. It is mainly used to treat cortical visual disturbances, cataracts, and myopia. Lower lateral line of occiput. Lateral inferior to the upper lateral line of the occiput, it runs downwards from Yuzhen, bladder 9, and is 4 centimeters long. It mainly indicates disequilibrium due to cerebral disorders and occipital headache. During the operation, the patient sits down. Sterilize the local point with alcohol. A 28 gauge to 30 gauge filiform needle is punctured quickly 1/2 to 1 inch deep at a 30-degree angle to the surface of the scalp. The scalp tissues are skin, subcutaneous tissue, gallia aponeurotica, subgaleal tissue, and periosteum. When the needle is inserted into the lower layer of the gallia, the resistance under the fingers decreases. Then the needle is parallel to the scalp. The twisting method is the primary means of manipulation in scalp acupuncture. For controlling the needle depth and for convenience in twisting the needle, you should hold the needle handle with the palm side of the thumb, and the radial side of the index finger. Twist the needle about 200 times per minute. The manipulation should last 2 to 3 minutes. The needles are retained for 5-10 minutes. Twisting can be substituted by electric stimulation, for which the frequency is 200 to 300 times per minute, and the stimulation intensity is given according to the patient's tolerance. 10 treatments are taken as a course. After a rest of 5 to 7 days, the second course of treatments begins. The sensation of scalp acupuncture is hot, distending, numb, cool, and drawing. During scalp acupuncture, pay close attention to the degree of stimulation to avoid fainting. Observe the facial complexion and the expression of the patient. There are a lot of vessels on the scalp, and it is easy to produce bleeding. Therefore, after withdrawal of the needles, press the needle hole with dry cotton. Another point that should be considered is that it is not advisable to apply scalp acupuncture when the patient is in a condition of acute cerebral hemorrhage, high fever, or heart failure. Ear acupuncture. Ear acupuncture is a kind of therapy for treating and preventing diseases by stimulating the ear points with needles or other materials. Traditional Chinese medicine theorizes that the ear is closely related to the Zangfu organs and meridians. It is recorded in the ancient classics that the ear is closely related to the kidney, liver, and lung, physiologically and pathologically. In order to master the location of the ear points, let's see the superficial anatomy of the auricle. Helix, helix cross, antihelix, superior antihelix cross, interior antihelix cross, triangular fossa, scapha, antitragus, tragus, ear lobe, Simba concha, and cavum concha. The distribution of ear points has its regularities. The ear points related to the upper limbs are mostly in the scapha. The ear points related to the lower limbs are mostly in the superior and inferior antihelix crura. The ear points related to the body trunk are mostly in the antihelix. The ear points related to internal organs in the pelvic cavity are mostly in the triangular fossa. The ear points related to internal organs in the abdominal cavity are mostly in the Simba concha. The ear points related to internal organs in the thoracic cavity are mostly in the cavum concha. And the ear points related to the head and face are mostly in the earlobe. The indications of ear acupuncture are basically similar to traditional Chinese medicine. There are 4 principles in selecting ear points. 1. Select the points according to differentiation of syndromes based upon the theories of Zangfu organs and of meridians in traditional Chinese medicine. For example, select puncture, kidney for tetanitis. 2. Select points according to symptoms based upon the knowledge of modern medicine. For example, select puncture, depressive groove for hypertension. Three. Select related ear points based on clinical experience. For example, select puncture, ear apex for redness, swelling, and pain of the eyes. 4. Select the points according to the diseased area. For example, select puncture, stomach for stomach disorders. Examination methods of ear acupuncture. 1. Observe directly the corresponding area of the disease to see if there is any positive reaction spot. 2. Search for the tender spot on the corresponding area of the disease with a probe or other instrument. 3. The electric resistance of the corresponding area decreases when one is sick. Detect with a conductant instrument. The tender spot with low electric resistance can be displayed by sound. In ear acupuncture, the filiform needle is often used. And electric acupuncture, hydroacupuncture, intradermal needle therapy, bleeding method, and seed embedding methods are also used. The auricular cartilage has a specific affinity to Pseudomonas aeruginosa, so strict sterilization should be given before and after acupuncture to avoid infection. Ear acupuncture has broad clinical applications for painful diseases, inflammatory diseases, allergic diseases, endocrine and metabolic diseases, chronic diseases, particularly infectious diseases, dysfunctional diseases, and is also used in cosmetology, ear acupuncture anesthesia, and abstinence of cigarettes and drugs. Acupuncture anesthesia. Acupuncture anesthesia is a kind of anesthetic method which is given before surgical operations when the patient remains conscious by puncturing proper points. It is an important medical achievement of some researchers combining traditional Chinese medicine with Western medicine based upon the functions of acupuncture to relieve pain and regulate the physiological functions of the human body, and by incorporating the knowledge and methodology of modern science. Acupuncture anesthesia has the advantages of safety in utilization, wide indications, easy operation, economy, less physiological disturbance, rapid recovery after operation, and development of subjective initiative of the patient. And it offers a new method of anesthesia for those patients who cannot accept the traditional drug anesthetic. Before the operation, the physician should inform the patient of the significance, characteristics, methods, procedure, and effects of acupuncture anesthesia. And he should also explain the conditions which may occur during the operation and various things the patient will need to do in order to obtain the cooperation of the patient during the operation. If necessary, the patient should receive pain threshold and preoperative training. The selection of points in acupuncture anesthesia includes body points and ear points. Principles in selection of body points. 1. Select the points along the meridians. For example, select Zusanli, stomach 36, for operations of the stomach. 2. Select the adjacent points. For example, select Jiache, stomach 6, and Hegu, large intestine 4, for tooth extractions. 3. Select the points according to nerve distribution. For example, select lumbus 3, lumbus 4, and nerve trunk for operations of the lower limbs. Principles in selection of ear points in acupuncture anesthesia. 1. Select points according to the theory of Zangfu organs. For example, select liver for eye operations. 2. Select the points according to the operative area. For example, select Lanwei Xue for operations of the appendix. 3. Select the points according to innervation and anatomical physiology of the ear points. For example, select puncture, auricular vagus nerve root, for operations of the abdominal cavity. Before the operation, first manipulate the needle of the points according to the prescription for 20 to 30 minutes. It is called the common induction, and 5 minutes before the operation, manipulate the needles of the important points. It is called the important induction. Acupuncture anesthesia should be given when the needling sensation has been obtained. The twisting method is applied in needle manipulation of the body points. The amplitude is 90 to 360 degrees. Or the method combining twisting and lifting thrusting is applied. The lifting thrusting amplitude is 5 to 10 millimeters. The frequency is 100 to 200 times per minute. Only the twisting method is applied to the ear points. In acupuncture anesthesia, electric stimulation is also an applicable alternative, with a medium stimulation of the dense wave. Before or during the operation, some calmative, analgesic, and cholinelytic can be combined properly in order to increase the effect of the acupuncture anesthesia. Take out the needles immediately after the operation or retain the needles indefinitely to avoid postoperative pain. An operation with acupuncture anesthesia is given when the patient is conscious. Therefore, the operation is required to be steady, precise, light, and rapid. At present, there still exists incomplete analgesia, muscular spasms, and pulling reactions of the viscus in acupuncture anesthesia. Therefore, all unnecessary stimulation during the operation should be decreased. Acupuncture anesthesia, combining acupuncture and surgical operation, increases the curative effect of the operation. With the deepening of research on the meridian theory, pain physiology, and the anesthetic principle, this clinical technique will continue to be a very promising therapeutic science.
一路漫漫，披迹相伴，